Rand in support of the battle against COVID-19. The Telkom Group Chief Executive, Sipho Maseko, said the funds will be used to support the healthcare workers who are at the front line of the battle against the spread of COVID-19, particularly in South Africa's most vulnerable communities. We are now joined on the line by Nomalungelo Faku, the Group Executive for Communications at Telkom. Nomalungelo, very good afternoon to you. Thank you so much for joining us. Welcome to SA Today.
Good afternoon and thank you for having me.
Take us through what kind of support that Telkom is providing to the health department.
So the health department has identified their list of priorities, and our donation of 50 million is ready to go towards the health department in the list that they've identified. And it's largely supporting the frontline health workers who are essentially the backbone of the health system to have, one, the equipment that they need to be able to do the testing that the department is looking at, as well as supporting them within the units in various ways.
So who are the direct beneficiaries of these funds? Is there a plan in place in terms of the disbursement of these funds?
So the ministry has a very clear plan about what it needs to do, and based on that plan, that's how the funds will be dispersed. So it will buy the equipment that they need, it will buy the testing. There needs to be tracers as well. It will support the tracers to make sure that they're able to trace people and their recovery in communities. As you know, as the public health...
So you are saying that the funds will then be dispensed to the Ministry of Health without Telkom being actively involved in the fight against coronavirus?
No, we are actively involved. So this is one of a number of initiatives that we've got. So the donation is one thing. We zero-rated earlier in the week, last week, all the educational sites to allow schooling to continue. We are also looking at supporting the department in other ways, which includes the zero rating of the number to the public on coronavirus information. And this is an additional layer which looks directly at the frontline staff of the medical facilities.
So will it come in packages, or is it going to be just a lump sum?
It's a lump sum because the funds are required immediately in order for us to do for South Africa, in fact, to achieve the levels of prevention and of the spread of the virus that are needed.
Well, you'll recall, Nomalungelo, that just earlier this year, Telkom issued a notice in terms of Section 189 of the Labour Relations Act that it intended to cut some 3,000 jobs as some form of austerity as a result of the falling earnings. So will this not be construed as an insult to those workers who face retrenchment?
I think that all South Africa faces the challenges. These times are unprecedented that we are finding ourselves in. And this spread of this virus is unprecedented in what we expect for it to do for South Africans and indeed across the world. So the funding is required to reduce that and enable all of us, Telkom included, sustainability into the future. I think the previous speakers that have spoken have said that this is unprecedented and we've treated it as such.
Well, agreed. It is totally unprecedented, and it's a very difficult time for every South Africans. I mean, in each and every sector, the social services sector, the business sector, everybody is involved in the fight against the COVID-19. But the big question is, and I'm reiterating that question to you, is that will that not be fair for the 3,000 workers of Telkom who face retrenchment? Because the very reason for the Section 189 is that there is insufficient funds for the sustainability of the employment of those 3,000 workers. So if then Eskom comes and donates 15 million towards this worthy cause, so will that not be seen as unfair?
Actually, we've gone through a process of consultation. So when we published the number of 3,000, it was publishing our intention to consult. Through the process, we've had over 2,500 people who have voluntarily, because they had reached a certain age for some, and they had met the limit for retirement, who have opted to do that. So as we stand today, 2,500 people have opted to voluntarily take the proposed packages. Over and above that, I think even for our remaining workers, this donation is important because the public health system supports them and their families as well, including the ones that have taken the severance.
So of the series of consultations I've just mentioned, did those consultations include, the labor unions, the worker representatives, or the workers themselves?
So the consultation process is defined by regulation. which is what the Section 189 process is. And within that process, it's facilitated by the CCMA. So the process that we have gone through is a facilitated process by the CCMA. And as I've mentioned previously, the number that we have of people that have voluntarily taken a severance package were defined within that scope of discussion.
Well, perhaps what we need to know in simpler terms, Nomalungelo, is that were the workers consulted?
Yes, they were.
All right. Nomalungelo Faku, Group Head of Communications at Telkom, thank you so much for joining us. Much appreciated.
Thank you.
Well, that was the Group Head of Communications at Telkom, just giving us an update with